Welcome to yet another edition of Arirang TV's special coverage of COVID-19. I'm Min Sun-hee. Despite the frightening impact of the pandemic on the globe, North Korea has yet to confirm a single case of the virus. All this amid conflicting reports over the North Korean leader's health. We have more on the situation across the border later on the program, but first, as always, let's take a look at the headlines for this Wednesday with our Kwon Soa and Noaram. Welcome.
Hi.
So we'll start with you. With the number of new COVID-19 cases on a decline, the government is now focusing on the economy, I understand.
Right. Now that the government is getting ready for the transition into everyday quarantine and also relaxing social distancing, officials are emphasizing a swift recovery of the economy. And that was highlighted at a daily briefing this morning. Prime Minister Chung Se-kyun, who mentioned that although there are always chances of a new outbreak, the general situation in Korea has stabilized, meaning the country is at a stage where it can focus on the economy just as much as it is focusing on continuous efforts to contain the virus. He emphasized the agriculture sector has been exhausted from the pandemic, calling on discussions to support that sector. And he also asked for cooperation from the nation's people on boosting consumption of agriculture and marine products. And in the meantime, Korea's Agriculture Minister Kim Hyun-soo took part in a video conference of the G20 agriculture ministers on Tuesday, discussing global efforts in the food segment and expressed the need to maintain global food supply chains.
All right, let's hope that numbers on the economic front soon mirror the trend on the COVID-19 numbers here in Korea. Let's have the latest figures then.
All right, well, as of 12 a.m. this Wednesday, we have 11 new confirmed cases, and that brings the total number of infected cases to 10,694, and the death toll stands at 238. Meanwhile, more than 2,170 people are still in quarantine, while more than 8,200 people have fully recovered. If we take a look at the past week, last Wednesday on April 15th, we had 27 new cases, and then we dropped down to 22 on the following 2 days. And on the weekend, we saw a decline to 18 and 8 cases. And then on Monday, we started off with 13. On Tuesday, we dropped to the single digits again, and now we are at 11 cases, which means that for 5 consecutive days, we had new cases in the teens or even lower. And now by region, we can see that the capital Seoul has 2 new cases, Gyeongsangbuk-do Province 2, and also 2 new infections in the city of Busan, while Gyeongsangnam-do Province has 1, and another case occurred in Daejeon. And meanwhile, Seoul and Gyeonggi-do Province account for roughly 6% of total cases, and Daegu for 64%. Meanwhile, 5 cases are related to domestic infections, and 6 are imported cases, and all of these cases are South Korean nationals. And those are the domestic updates.
Meanwhile, elsewhere around the world, I understand cases in Brazil are surging.
Right. The country has reported more than 2,400 deaths in a day, as well as over 160 deaths on Tuesday local time. In total, more than 43,000 people have been infected, with the most severe hotspot being São Paulo, the epicenter of COVID-19 in Brazil, with some 15,000 cases alone and around 1,000 deaths in total. Now, the problem is that Brazil is one of the countries where researchers claim the nation's health ministry figures are inaccurate. In fact, there are likely to be more than 10 times the number of COVID-19 cases than the official tally. And according to a UN report, the pandemic will cause the biggest recession in Latin America since the Great Depression in 1930, with skyrocketing unemployment. And Brazil's President Jair Bolsonaro is being criticized for putting the economy ahead of the health of the people, as he also recently joined anti-lockdown protests. Meanwhile, Brazil, a country home to more than 200 million people, has imported the biggest amount of coronavirus test kits from South Korea, worth some $19.2 million US. And that is more than the US, which purchased Korean testing kits worth some $15.5 million. And speaking of the U.S. has now more than 820,000 cases with more than 44,000 fatalities, and Turkey has more than 4,600 new daily cases for the second consecutive day, while Germany's death toll has surpassed 5,000. Of course, Germany is one of the countries that has a lower mortality rate. And speaking of Germany, in fact, as a preemptive measure, it looks like they have canceled the iconic beer festival, the Oktoberfest, just to make sure, because it looks like there will be a long-term effect of the coronavirus.
All right. Well, thank you for that. Aram, I understand President Moon Jae-in presided over the 5th Emergency Economic Council meeting. What was exchanged there?
Well, Moon certainly did start the meeting with a word of warning. He said the crisis, economically speaking anyway, was just the beginning. Here he was speaking at the meeting earlier today.
지금은 위기의 시작 단계입니다. 기업의 위기와 함께 고용 한파가 눈앞에 다가오고 있습니다.
Yes, certainly a word of warning there. And also during the meeting, the president announced a 40 trillion won or $32 billion relief package for Korea's key industries disrupted by the coronavirus pandemic. The funds are meant to help both the businesses themselves as well as their workers. The hardest hit industries include aviation, shipping and the auto sector, among many others. And Moon also unveiled an additional job protection scheme that involves spending about 10 trillion won or $8 billion. He also said the government will play a leading role in creating jobs, adding that 500,000 will be offered, many for young people. Elsewhere, Finance Minister Hong Nam-ki is scheduled to chair a meeting of top economic policymakers starting next week in response to coronavirus damages. And meanwhile, global credit rating agency S&P has maintained its long-term and short-term credit ratings for South Korea at AA and A1+, respectively. So some promising signs there.
I see. So I mentioned Germany is stepping up its fight against COVID-19. It cancelled the Oktoberfest, like she said, and it's looking to follow Korea as a model for efforts to contain the contagion.
As we saw in the figures that Soa presented earlier, Germany is one of the countries in Europe that has been getting praise for its response to the outbreak. It's been one of the countries worst hit by COVID-19, but also one of the quickest to respond, hence the low death rates compared to cases. And some of that, according to Chancellor Angela Merkel, is down to its benchmarking of Korea's strategy. One of Korea's strategies, she said Berlin had borrowed, was Korea's contact tracing tactic. She also noted that other methods used in Korea served as a good model for Germany, although it has been catered to the country. Merkel said Germany must stay cautious and disciplined, though, in its fight against the outbreak to avoid a relapse in the coming weeks. The country, like many others in Europe, has started to ease restrictions on public life. Merkel said the country will be able to see if such relaxations proved well in the next 2 weeks, so that time period is crucial, according to Merkel. She, however, warned against complacency, as officials here have also been saying in Korea, saying the eased restrictions were only a cautious first step. And the situation in Germany seems to be so good that it will also cover the cost of treating coronavirus patients taken in from neighbouring EU countries as a gesture of goodwill.
That is quite commendable. Meanwhile, here in Korea, the government is still advising against travel overseas.
That's right. The Foreign Ministry has extended its so-called special travel advisory by 1 month, so it will be in place until May 23rd. It urges citizens to refrain from going abroad as the pandemic continues worldwide. The government issued the special advisory on March 23rd, so on all countries and territories. It will all automatically be lifted unless the government extends it again. The ministry said it is applying entry restrictions on foreigners as the outbreak is still posing a threat globally.
All right, Aram, thank you for that. We have the briefing you just started. We'll come back to you after the briefing.
And as of April 22nd, the total number of confirmed cases stands at 10,694. This includes 1,017 imported cases from overseas. Of the total, 77.4% or 8,277 have been discharged following full recovery. As of yesterday, we had 11 more cases and 64 more people have been discharged. And yesterday, we also have had one more fatality. I extend my deepest condolences to those who have passed away and the members of the bereaved families. Out of the 11 new cases, 6 of them were imported cases and 5 have been through community transmissions. And looking at the sources of infection during the past 2 weeks, recently we had imported cases and the cases that were related to imported cases, and these ratio has been on the rise. And also centering around multi-use facilities, including the nursing hospitals and hospitals, there were about 14% of them, and 15% were related to cluster infections, which saw a slight increase in the ratio. And there were also reported cases of those related to Shincheonji, as well as those who have been come into contact with the confirmed cases. There are 11 cases under investigation. Yesterday, we had 6 people from imported cases. 2 were from the Americas, and 2 were from Europe, while 2 were from Japan. And the regional breakdown of the cases is as follows. In Busan City, we also did screening testings of all of the people at one of the hospitals, and we also confirmed one more person there, and we have a total of 3 people, and we are currently doing the epidemiological investigation. And in Yecheon-gun County of the Gyeongsang-buk-do Province, we have 1 more confirmed cases, and a total of 38 people have been confirmed so far. The KCDC sees that those patients that have been recovered and after they have developed the antibodies, we are seeing whether they can be reinfected again. And we are doing the analysis, and the interim analysis is as follows. We did a testing on about 2 dozen of people, and we say that we confirmed that these people have developed the antibodies, and about 48% of the tested, which accounts for 12, they had the antibodies. However, they tested positive for the coronavirus in their samples. So it means that even though the patients are treated, the virus still remains within the body, and this period may differ among people, and we are currently doing continued research and analysis. As for the 12 people, we are going to do the virus culture analysis, and we have done them, and the primary testings proved negative for the virus. We will update you if we have any more updates. And the KCDC has been leading the relatively easy social distancing measures until May 5th, especially when you go to crowded places and closed-door places. We also advise these facilities to suspend operations. If they need to be open, we advise all of the employees and the users to check their respiratory symptoms and have a visitor log, and all of the users need to wear face masks. They need to disinfect the area, and they also need to have regular ventilation. And in order to curb the further virus spread of the coronavirus, it is crucial to have social distancing, physical distance, and also keeping personal hygiene measures such as washing of your hands is very important. And it is best to avoid going to crowded places, and if you have to visit these places that are crowded and enclosed, you should keep at least 2 meters of distance from others, wear a face masks, and maintain hand hygiene by washing your hands and using hand sanitizers. And moreover, if you have any symptoms, please do not go to work or leave home, and you should go to a screening center and be tested as soon as possible. This morning, we also provided an update, and we also have dispatched disclosed some press kits related to the vaccines. And the KCDC believes that despite the spread of the coronavirus, we believe that safe vaccination is very important for the elderly as well as children. And we have analyze the ratio of vaccination during the first quarter of this year, and especially for pneumonia, pneumonia vaccines for the elderly has dropped by 1/3. So by figures, compared to last year, we had about 18.2%, but it dropped to about 6.2%. And as for the children, the babies, we also have a list of diseases that they need to have mandatory vaccinations for. However, we saw that this decreased by 1 percentage point. And also there are a list of infections that need vaccinations after the ages of from the ages of 4 to 6. But this also decreased by 2 to 3 percentage points. However, as for the vaccines that are done before the age of month 12, we also have a similar rate compared to the year before. And the reportings, we also, fortunately, we have a reduced reporting on the diseases that are preventable through vaccines. And especially for chickenpox, we see a decline by 30%, which is a very positive trend. However, the pneumonia, as for the elderly, is also has been increasing by 16%. So we believe that this was possible, and thanks to the delay in the school openings, and also many people also participated in the social distancing and hygiene measures. So we had an overall decline in the ratio of infectious diseases. However, if you halt and if you delay the mandatory vaccinations, you will also have a higher risk to other infectious diseases. Therefore, it is very crucial to get these vaccinations. And when the schools are open again, chickenpox and other infectious diseases could also be on the rise. And also, if we have any exchanges with other countries, we would be prone to other infectious diseases. And as for the elderly people, these they will be have a higher risk of complications and other risks. So it is very crucial to get vaccinations at a necessary time. The KCDC will also make sure that the public is ensuring a safe vaccination, and we will cooperate closely with the medical circle. And first of all, we have a list of guidelines that the medical facilities need to abide by, and also the guidelines that the parents and the guardians need to comply with when they visit the hospitals. And we ask for your participation. The main summary is as follows. So if you need to make a visit to the doctor, please get your vaccinations on a reservation basis. And if you go, please wear your face masks and disinfect your hands when you go there. And second, in order to ensure a safe environment, we will have a booking system in advance so that you could book your doctor's visit in advance. So starting from end of May, you could also do the bookings and reservations via online and via telephone calls. And also through beginning from June, we will also have a reservation through mobile application. And to provide more information to the elderly people, we will have brochures that will be given out to the senior citizens. And as of now, we are seeing a pandemic of the coronavirus, and I believe that many people are refraining from going to the doctors, and thus we have a decrease in the rate of vaccinations. However, we believe that these vaccinations are crucial, and you need to get these vaccinations at a timely manner. And we believe that these risks of other infectious diseases could increase and surge as soon as we open our schools and when we have overseas travel. That's all for me. Thank you very much.
Right, we apologize for the abrupt connection to the Central Disaster and Safety Countermeasure Headquarters. I believe the briefing started about a minute earlier than expected, but I still have our Khon Soa in the studio to give us a wrap-up of the key announcements, Soa.
All right, well, let's start with what Chief Chung Eun-kyung said just right now about vaccinations, because many people are refraining from going to the doctor since the pandemic broke out here in South Korea. And she just mentioned that regardless of COVID-19, people should get their recommended vaccinations, including vaccinations for measles and chickenpox, because it is crucial to get those vaccinations in spite of COVID-19. And she also gave the briefing on the latest occurrence of cases, of course, and the sources of infections, which are related to nursing homes and hospitals, as well as imported cases. And she also mentioned to abide by the relaxed social distancing measures until May 5th, as the government will now start to announce everyday quarantine guidelines step by step after consultations.
So members of the public need to keep their guard up then?
Yes, of course.
All right, Soa, thank you for that.
My pleasure.
On April 18th, the leaders of South Korea and the US held phone talks and agreed to keep the door open for humanitarian aid to North Korea.
Yes, I have let it be known that we'll help people, including North Korea.
This is amid concerns that North Korea may be ill-equipped to deal with an outbreak there, given its chronic shortage of medical equipment and weak quarantine capacity.
아직까지 우리나라에 신형 코로나 비루스 감염자나 확진자가 한 명도 나타나지 않았다는 사실이.
Although North Korea continues to claim that there have been no cases of COVID-19 in the north, it has not disclosed any data to back it up, while its borders remain tightly sealed. What is the real truth and reality of the COVID-19 situation in North Korea?
North Korea has yet to report a single case of COVID-19, despite the impact of the virus on literally every continent, perhaps with the exception of Antarctica as of early this month. To try and to better understand the situation up north, I have in the studio Ms. Sina Paulson, the head of UN Human Rights Office here in Seoul. Welcome, Ms. Paulson. And I have Professor Chung Gu-yeon from Gangwon National University. Hello, Professor Chung.
Hi.
Professor Chung, there have been reports of the reclusive leader being in critical condition. What are your thoughts on that?
Well, as you know, North Korea is a very closed society, as you know. So what we have so far is a very fairly limited information about what actually happened and what is happening. So it is premature to tell whether we have to expect something more surprising, in North Korea. And we have seen many false reports in the past about the leadership's health as well as execution of elite groups. So we have to, I think, we have to wait for the official announcement from the Joseon Central media or other public media from the North Korea for the credible information.
Ms. Paulson, do you have any information to share regarding the reclusive leader's health?
No, I can only echo what Professor Chung said about continuing to watch closely what developments we see from North Korea.
Of course. Professor Chung, President Moon Jae-in and his US counterpart Donald Trump spoke on the phone, I believe, on April 18th and talked about humanitarian aid for North Korea in light of COVID-19. Why do you suppose the two leaders spoke of such assistance?
Well, it is a coronavirus 19, so it is kind of global in a pandemic that no one and no state is immune from the spread of contagion. So from the humanitarian perspective, it is pretty natural to talk about the kind of current situations and what's going to be happening in the North Korea, because it is right next to South Korea, which, US forces also are located in South Korea as well. So it is pretty important to watch the current situation. But at the same time, for the President Trump, US is heading towards elections in November. So he might want to think about accomplishments to sell the American borders in November.
Ms. Paulson, I understand the United Nations has already provided aid to North Korea to allow them to better prepare for COVID-19. Could you tell us a bit about that?
Yeah, sure. Of course, the United Nations has for a long time had humanitarian actors working up in North Korea, World Health Organization, World Food Programme and others. And they seek to address the long-term challenges that North Korea faces in terms of humanitarian assistance, so things like addressing food insecurities, water and sanitation, and all of those long-term problems and long-term programs will actually have a critical role in how North Korea can respond to the COVID-19 endemic. The particulars of how assistance related to Corona is given is still underway and will be done by the experts. But more than that, perhaps the UN Secretary General and also the High Commissioner for Human Rights has consistently emphasized that as this is a pandemic and a global crisis, it's something that the world needs to address in a spirit of solidarity and cooperation rather than as single countries. And I think this is one of the key messages that we really need to take into account. And that's not different from North Korea than in any other country.
Of course. Professor Chung, back in early February, the North Korea's Ministry of Public Health called on the international community for help with quarantine efforts. Could this be an indication that the COVID-19 situation up north is actually quite serious?
Well, given that in North Korea, we see that very lower population density as well as lack of freedom of movement, we can expect that, well, in North Korea, there are relatively low level of contagion, but North Korea announced that more than 2,000 people are actually quarantined. And that number might be credible, but at the same time, we have to think about their testing capability. Given that they do not have any testing capability and also diagnostic reagents, we are not sure whether the number is really credible, and there might be more than just 2,000 in North Korea.
I see.
Yeah.
Ms. Paulson, given North Korea's poor healthcare infrastructure and widespread malnutrition, as well as the reality that it's subject to sanctions, the ordinary people there are probably most likely to bear the brutal brunt that is of the virus, that is. What do we know about the situation for ordinary North Koreans there right now?
Yeah, I think generally we know quite a lot. I mean, we know that people are facing food insecurity, a significant proportion of the population. We know very well about the poor infrastructure in the health sector, where although there are health facilities that are available to everyone, they also in many cases require people to make some kind of payment that they may not have access to, especially if they fall within this lower socioeconomic classes. And then there are a number of groups that we have particular concerns about. People like prisoners who are, you know, as have been widely reported, locked up in cramped conditions with poor hygiene and sanitation and probably suffering from malnutrition as well. People who've been trading across the border who may have particular concerns in terms of also contamination and how you spread the virus. And a number of other groups, people in institutions, the elderly, as is the case in other countries indeed, but the lack of transparency and information in North Korea makes this a particular problem.
Which is why my next question to you, Ms. Paulson, was going to be transparency, like you just mentioned, it's very important to offer the international community a more accurate picture of what's happening up north and perhaps to prepare for a more appropriate course of action to help the people there. Why is North Korea so reluctant to release such information, do you suppose?
Yeah, I mean, this has been a issue when all of us who are watching North Korea from the outside, access to accurate information has been an issue for a long time. And of course it has to do with control, because it is a government that controls its population and probably also seeks to control the narrative about what is happening inside North Korea. But whether or not we have the information, the situation is what it is. So this is what we will need to address. The access to information is important for us, but it's particularly also important for people who are living in North Korea, so they have an understanding of what's happening. And it's not only about the corona disease or the virus itself, but also about the economic implications, about the additional restrictions that exist right now, perhaps on freedom of movement or other actions that people within what limited rights they had to start with, at least, you know, the way those are being even further restricted perhaps now. So all that information is incredibly important. in addition to disaggregated data, so not only how many cases, but what's the impact on women, on prisoners, and on children, on people in rural areas. All of that kind of information is something that would be extremely helpful in protecting the population inside North Korea.
Right. Now, before we continue, let's take a look at this next video of North Korea, brought to us through the eyes, that is, of a defector-turned-journalist who learned about the situation there via sources within the reclusive regime.
North Korea's state media has been providing comprehensive coverage of the global COVID-19 pandemic ever since January, when the outbreak was first reported in China.
미국과 일본, 대만과 남조선에서 각각 1명의 감염자가, 타이에서는 3명의 감염자가 발견됐다고 합니다.
However, according to sources, residents in the border region between North Korea and China reportedly claimed that North Korean authorities had rigorous quarantine measures already in place long before its state media began reporting on the outbreak.
일단 초기에 주민들한테 알리기 전에 당국 차원에서 국경 연선으로 들어오는 모든 인력이라든가 외교관들, 그리고 또 해외에 나갔던 뭐 유학생이라거나 이제 여행자들, 이런 사람들을 내부에서는 전혀 몰랐을 때 국경에서 이제 들어오는 족족, 지역에 있는 뭐 간염병동, 또 뭐 요양소, 그리고 또 일부 지역에는 막 초대소에도 사람을 넣었다고 하더라고요.
North Korea imposed severe movement restrictions and lockdowns in response to the outbreak, sealing off its border with China and placing all inbound travelers and people showing symptoms in long-term quarantine lasting more than 40 days.
국경과 지상, 해상과 공중을 비롯하여 신형 코로나 바이러스 감염증이 들어올 수 있는 모든 통로들이 완전히 차단 봉쇄되었으며
북한은 우려 상황이 정말 열악한 상태입니다. 그러니까 진단키트는 더더구나 없는 상태고요. 그러기 때문에 북한이 더욱 이제 방역이라든가 국경 봉쇄에 집중한 것으로 알고 있는데요. 진단키트가 없는 상황에서 의심자라고 생각되는, 그러니까 기침을 했거나 콧물이 있거나 뭐 미열 증상이 있거나 이런 사람들은 초기에 무작위로 이제 가택 연금을 하든가 아니면 그런 집단 이제 생활할 수 있는 그런 병원 시설에 격리를 했던 것으로 알고 있거든요.
North Korea has ordered its citizens to maintain good personal hygiene and has demanded complete obedience to state guidelines in this regard. North Korea's state media claims that many factories have been repurposed to manufacture sufficient quantities of masks, hand sanitizers, and other goods, but the reality may be quite different.
손소독제 공급은 좀 완전 부족했거나 하지 않은 지역이 좀 있었다고 보고요. 다만 마스크에 대해서는 초기에 북한이 강력 대응을 했던 것으로 이제 저는 조사했는데요. 북한 당국이 발빠르게 피복 공장이라든가 이런 관련 공장들의 마스크 생산을 지시를 했기 때문에 공급이 증가했다는 거죠.
North Korean leader Kim Jong-un and senior party officials have been witnessed in public recently without a mask on, a move that is being interpreted as a sign of confidence by North Korea in its handling of the outbreak.
일단은 외부에 우리나라 코로나가 없다는 걸 노동신문이 지속적으로 밝히고 있잖아요. 초기에 2월, 3월 초 중순까지는 북한이 마스크에 대해서 주민들한테도 강력하게 요구를 했고 엄청나게 이제 통제도 했고 단속, 교찰대가 도시에 나와서 이제 주민들을 단속할 그럴 상황이었는데 중국에서 코로나 확진이 안정적으로 된 이후부터 북한 내부에서는 마스크 착용에 대한 강력한 그런 통제나 단속은 이루어지지 않고 있다고 합니다.
Despite North Korea's claim that it's reporting zero COVID-19 cases, its poor healthcare infrastructure continues to be a source of vulnerability and running concerns for the international community.
Professor Chung, as we've just seen in the report, North Korea has launched draconian measures to curb the spread of the contagion. Is this an indication that North Korea is not prepared to deal with a large-scale outbreak?
Actually, as I mentioned earlier, they do not have enough diagnostic reagent as well as testing capability, but they do not have regulations and guidelines, for instance, to categorize different patients with different level of symptoms. So I heard that last week they just begin to make the guidelines and regulations from the government. So in that sense, they do not have bureaucratic and legal kind of framework to respond to this disease as well.
I see. Ms. Paulson, as stated in the report, North Korea has reportedly claimed that it has no cases of COVID-19. How reliable is their claim, in your opinion?
Well, the truth is we don't know. Certainly there is a possibility that there are cases, but without any testing or without any firm information from the government, we don't know. What also impacts on this, of course, are the restrictions, the general restrictions on freedom of expression and the lack of a civil society that could provide alternative views or additional information on that kind of information from inside North Korea. So that makes the claims very difficult to verify.
Staying with that, there is much debate over the credibility of North Korea's virus-free claim. And for more thoughts on that, I have live on the line Professor Cortland Robinson from the Bloomberg School of Public Health at Johns Hopkins University and Professor Park Ki-bom from Harvard Medical School. Thank you both for joining us, professors.
Pleasure to be here.
To be here, Sonny.
Professor Robinson, what are your thoughts regarding North Korea's claim of no confirmed cases of COVID-19?
It seems harder and harder to believe as the days go by. I mean, I've worked on the China-North Korea border. It's 900 miles. People move back and forth. There's trading. There's smuggling activity. With China loosening its controls on Wuhan, even more likely that people are possibly crossing over from China. This virus respects no boundaries, and I don't believe that it will ultimately respect the North Korea border. That doesn't mean to say I have any special information that it's there. It just seems highly improbable that there are no cases. It may be much more to do with the fact that they really have very limited testing capacity. So perhaps better to say no confirmed cases. It may be simply no cases that they want to acknowledge or really have a full understanding. But there's so many reasons to wonder what's going on, and the lack of any other sources of information, any independent media, civil society that's free to speak out and challenge if they feel the government isn't telling the truth. None of those really exist in North Korea, so we have to rely on what the government says. I'm skeptical, but I don't have any other information to confirm or clarify what the real situation is.
Meanwhile, Professor Park, I understand you believe North Korea has been relatively little affected by this global pandemic. Please share your thoughts with us.
I do think that they managed to dodge the bullet, and I'll give you my reasoning. I used to be one of those people that doubted this claim, but remember when the timing of North Korea shutting all of its borders, it actually happened even before China shut down Wuhan. They imposed comprehensive border closures. They stopped, obviously, all the flights. 3 days before, Wuhan was closed. And, in a pandemic timescale, even days can make a huge difference. And what's important is that North Korea closed down their borders even before there were any confirmed cases inside North Korea. I think that's the most important reason. Other reasons are, as you saw on the video, the country actually rolled out a comprehensive education campaign throughout the country, and they daily briefing of the people on the dangers of COVID-19. And they're very effective in public health interventions, and we know that. It's not just South Korea. North Koreans are also very good at that. And the third reason I have is the fact that the 900-mile border between China and North Korea, there's a lot of smuggling going on. And there was this fear that the cases of coronavirus will sort of be brought through the border. And I think that risk we may have overestimated. The reason is, if you look at the total number of cases that actually were counted within the Jilin province and Liaoning province, these are the two key provinces that are bordering to North Korea. There were 145 cases total in the Liaoning province and 100 cases total in Jilin. and there were 1 or 2 deaths in each province. And remember, these provinces also underwent semi-lockdowns pretty early, and they were able to control it. So I don't think there were that many cases of COVID along the border with China as well. And I want to mention one thing about testing kits, because there seems to be this message coming from your other speakers in the report that they don't have diagnostic capability in North Korea. I can confirm that they do. They do have the machines that can detect the DNA from the COVID-19 virus. And they were actually provided diagnostic kits from Russia and maybe even China as early back as January. And they're running about 60 tests a day right now.
Professor Robinson, very briefly speaking, how do you respond to Professor Park's thoughts?
I hope he's right. I mean, I'm not one to say that North Korea is covering up and there's a massive pandemic spread going on and that they're really sort of lying to all of us. That's not my thought or conjecture. I certainly think there are reasons to hope that some of these border controls, some of the restrictions on freedom of movement, problematic in other contexts. There's certain things you need to do in public health emergencies. We'd like to also see that they're limited in scope and duration and that they're subject to review. There's something called the Syracuse Principles, promulgated in 1985, which talk about restrictions on freedom of movement, freedom of assembly, freedom even of speech that may be needed to be restricted because people have to have some clear sort of message about what to do and how to behave in a way that protects themselves and the community. But we also need to have other checks in place to ensure that transparency of some degree exists in North Korea. And if there are concerns from the populace about treatment or mistreatment, about what is being done in an overly draconian fashion, I hope that we also can hear that. It may be that we look back and North Korea has, if you will, dodged the bullet. I have reason to fear that this virus is enormously tricky and deceptive and moves silently. Transmission is asymptomatic in half the cases by many estimates. So they would be very fortunate to have none. They do have a system in place, I think, to contain, to do the testing, do contact tracing, do containment. There's capacity there. I think they could be bolstered with some additional help from the international community. But we were talking about this a month ago, and I think people were very worried that there would be a massive outbreak in North Korea.
Right.
That does not seem to have happened. And I think there are reasons to be grateful for that. I hope that persists. And I also hope that we should remain attentive to the health and the well-being and hopefully the ability of the North Korean people to speak on their own behalf about what's going on.
Professor Park, I believe North Korea has asked the Korean American Medical Association, that is, of which you are a member, for medical support. How is the association responding to this request then?
Right. I think we need to just elaborate a little bit about this concept of dodging the bullet. It's one bullet, but the war is still going on. Now it's a full-blown pandemic, right? Over 2 million confirmed cases out of in the world. So the North Koreans are clearly feeling confident that their measures are working, but the pandemic's still going on, the threat is still out there. And I'm afraid that eventually the virus will enter the borders and there might be an outbreak. And this is why the North Koreans, while they're instituting very, very aggressive all-of-government containment measures, they're also trying to beef up their health system. So there's an estimate from the Imperial College in London looking at how many North Koreans could possibly die if an outbreak were to occur inside North Korea. So on the low end was 7,000 deaths, but on the high end it was 150,000 deaths. And that reflects the level of mitigation that they were able to apply. The important thing here is that they also calculated the capacity, the hospital capacity that would be needed to treat the outbreak. And at a minimum, they need about 13,000 beds, but 2,500 ICU beds. Now, the implication with ICU beds is that they have oxygen, ventilators, and those kinds of things. And I can tell you they don't have that many beds. And this is why the North Koreans, while they're trying to contain, at the same time, they're trying to improve and build on their capacity. I think the new hospital that's being constructed in Pyongyang is an example. And there was an oxygen generation factory that was just opened in North Hamgyong province. So these are some evidence North Koreans are trying to build capacity, but they're also looking outward for assistance. And we were approached as well as the other U.S. NGOs. But right now, politically, it's not the best time to deliver assistance.
Right, Professor Park. All right, that's all the time we have for that right now. Professor Park and Professor Robinson, thank you very much for joining us at this hour to share your thoughts.
Pleasure, thank you.
Right, back here in the studio, first, Professor Chung, I'm assuming the aid that we are seeking to provide North Korea is within the boundary of sanctions imposed on it. It's not violating the sanctions, is it?
It depends on the item that we want to deliver to North Korea. When it comes to food and like a medical kind of medicine, that might be okay to pass through the border. But when it comes to like a metal kind of kits and like or something we can use for the medical purposes, that might be prohibited under UN sanction system. So it depends on the cases.
I see. Ms. Paulson, Seoul has repeatedly revealed intentions to help Pyongyang deal with COVID-19. In that regard, how could Seoul perhaps help its northern counterpart?
Well, I'm sure there are many different ways that Seoul could help, but we have seen some good practices emerge from the way South Korea has dealt with the COVID-19 pandemic, and some of those lessons might be transferable also to North Korea, although of course the context is very different, both in terms of the population and the healthcare system and many other things. But short of that, also on the sanctions, I think we can look at the different sanctions regimes that exist. There's one which is the UN system of sanctions, where the Sanctions Committee now is able to give exemptions for COVID-related materials very fast, even within a few days these days. And that wasn't always the case, but now they are. And then there are other sanctions that may have different implications as well.
All right, Ms. Paulson and Professor Chong, I'm afraid that's all the time we have for today. Thank you for being here with us.
Thank you.
Right, that brings us to the end of the program for today. Join us tomorrow at this hour for a look at how Korea's entry restrictions and quarantine protocols are helping containment efforts stay on track. In the meantime, do reach out to us through our social media accounts or our homepage, arirang.com. Thank you for watching.